Hi, and welcome back. As promised, an up-close and personal look at your HCPCS book. This is a common cover for one of them. They are divided into sections like your other code books. HCPCS Level 2 is really a subset of your Level 1 code set, which is your CPT. Here is an example of your alpha index. Always start with your alpha index, then look up your code in your tabular listing. There are different ways to look things up, so this page just gives you a snapshot. You can look at casts, and you have your casting from general supplies to different kinds of casts. You have catheters, which can be anything from dialysis to vascular to urinary catheters. You can look up cervical. You have different things like cervical cancer screening and cervical collars. You can also look up chairs, and you can get anything from shower chairs to chair lifts. Or you can look up classes, and you have anything from nutrition to chronic diseases to childbirth. Appendix B is your table of drugs. I wanted to show you an example of your table of drugs so you could become familiar with the 5 columns that you have. First, you have your drug name. Your second column is any additional drug names like brand names or generic names. The next column is your dosage of the said drug. Your next column is your delivery method. And your delivery method is many different ways. It can be IM for intramuscular, IV for intravenous, it can be other, it can be inhalation, or it can be subcutaneous. Then you have your HCPCS code. Once you find that code, then you want to always look for it in your tabular list. Next, I wanted you to look at the different formularies. So you have albuterol that's compounded, you have albuterol, all formulations non-compounded, and you can have albuterol with ipratropium bromide, which would be your duonebs. Notice they all have different codes, but they are all dispensed via inhalation through a durable medical equipment. Okay, next we have another page out of your table of drugs. There's a couple different things on here. If you look at the ramacedin, it's an irrigation solution for bladder calculi. It's per 500 milliliters, and the administration route is other. The other things that you can look at is your RhoGAM, which is your Rho immune globulins. These are usually used for moms that are Rh negative, but it's also used in some different blood disorders. I want you to pay attention to the fact that there's just different dosages. And a rule of thumb, remember, if a code exists in your CPT book for the same medication, your default will always be your CPT book. So, if you take a minute now and look at 90384 to 90386 for RhoGAM, you'll see what I'm talking about. Okay, another thing I want to pull your attention to is if you look at Rocephin, the dose is per 250 milligrams. That's a very small dose for Rocephin, so if your provider dispenses 1,000 milligrams or 1 gram, you want to make sure that you use your units to decipher and pull up your complete dosage. So you'd put in Rocephin, your J0696, and you'd put in 4 units in order to capture the whole dose.